Hello, this is Dr. Keith Newby with Fort Norfolk Medical Associates and the James E. Newby Jr. Foundation. Let's Talk Health is a medical minute production designed to educate and enlighten our community on various healthcare topics, the goal of which is to help you achieve your optimum health, both physically, mentally, emotionally, financially, and spiritually. Each week, I will address a different topic relevant to our everyday lives, so let's get started. Today, we will begin our discussion about heart disease. First, we will define what is heart disease, and that will be followed by what is deemed as the normal physiology of the heart. In order to understand the abnormal physiology, we first have to define what's normal. So heart disease is defined as anything that affects the heart or the great vessels. Now, we know the heart's a pump, and that pumps oxygenated blood to the rest of the body. Well, how does it get to the rest of the body? Well, that is through the great vessels. The aorta, which is the main artery that comes out of the heart, and that actually has the coronary arteries that come off first, and that supplies food to the actual heart itself. The carotid arteries that supply blood to the brain, the subclavian, which goes to the arms, and then the iliacs and femorals, which take blood to the legs. And in the middle, of course, blood has to get to the organ systems, the GI system, which is gastrointestinal, the kidney arteries, liver, so forth and so on. Now, when we look at what actually happens, well, blood carries oxygen. Every cell needs oxygen in order to function. And the red blood cells are what carries that oxygen, but something has to pump it around, and that's where the heart comes in. Look at the red blood cells kind of like a train, and the payload or the cargo is the oxygen itself. So say train comes into the station, doors open, people get on the train takes off. Well, look at the lungs as like the train station. So when you take a breath in, oxygen gets down to that area and it sits there, waits for something to take it somewhere else. The red blood cells come through like that train. The oxygen then jumps on the red blood cells, and then the red blood cells take off and takes oxygen to these various places of the body. Now, I think that is kind of the start to talk about what is deemed as normal. And we will get into our next discussion talking about some abnormal things. But I want to stop there because, again, I want to keep your attention and keep you focused on what I'm saying. This is Dr. Newby, and if you have questions as we go along, I would love to hear from you. My email address is dr.newby, and that's dr.newby@yahoo.com. And if you send those to me, I'll actually will read your questions aloud on the air and into these podcasts, and we will answer them at that time. And I'll try to post them on our website as well. So again, thanks for tuning in, and I hope to see you again soon. Thanks for listening. I truly hope this message has somehow helped you and will start you down a path of good health. I'm more than happy to answer any questions you may have. Email me at dr.newby@yahoo.com. That's dr.newby@yahoo.com, and I will read and answer your questions with the next podcast. Take care and God bless.